When a dog stops eating or a cat suddenly isolates, owners usually notice immediately. But those visible symptoms often appear days or even weeks after the body has started fighting an issue internally. That delay happens because animals carry a deeply ingrained survival instinct to mask their weaknesses. In the wild, displaying pain is dangerous. Even though our pets live safely indoors today, their biology still compels them to hide discomfort and adapt. To catch those subtle, hidden changes, we can use a daily physical observation tool, the 10-second ear check. It operates as an early warning system, allowing you to notice minor shifts in your pet's temperature before any obvious behavioral symptoms emerge. By the end of this guide, you will learn how to perform your first accurate thermal check using nothing but your hands, and you'll set up a customized daily tracking log to monitor your results. Before we begin, you need to establish 3 prerequisites: a pet resting calmly indoors, clean and dry hands, and a simple tracking log. The entire goal of this process is familiarity. By learning exactly what your pet's normal, healthy state feels like, you build a mental reference point that makes biological shifts stand out immediately. Step 1 is controlling your environment. You must select a time when your pet has been completely at rest indoors for at least 30 minutes. The most common failure point in this process is collecting bad data. If you attempt this check immediately after a walk, during active playtime, or while your pet is sleeping next to a heating vent, their temperature will be artificially elevated, making the check useless. Once your pet is relaxed, we use the 3-finger calibration technique. Place your index finger gently on your pet's forehead. At the same time, press your middle and ring fingers flat against the outer base of their ear. You are not trying to measure a specific number or degree. You are simply comparing the 2 areas. The forehead serves as your control, and the ear serves as your variable. As you hold your fingers in place, make a quick mental note. Does the ear feel noticeably warmer than the forehead? Is it cooler? Or do the 2 areas feel about the same? Repeating this relative comparison at the same time every day builds a subconscious baseline in your mind, eventually to your touch. When executing this check, many owners make the mistake of feeling the very tips of the ears. This leads to highly inaccurate health readings. Notice the dense concentration of blood vessels packed at the ear's base. The thin upper edges fail as a reliable gauge because they are easily cooled by room drafts. Conversely, the base remains tied to the cardiovascular system. Its heat reflects true internal body changes. By strictly testing the dense base of the ear, you ensure that you are tracking systemic body heat rather than reacting to meaningless environmental noise. Performing an isolated temperature check provides very little insight. To make this information actionable, you need a logged history to compare it against, what we call a thermal map. Here is a look at how to structure your daily log. Every entry requires a date, your relative temperature comparison between the ear and forehead, the current weather context, and behavior notes. Tracking the environmental context is vital because seasonal shifts drastically affect baseline norms. A heavily coated dog resting indoors during deep winter will present a completely different thermal baseline than that same dog in midsummer. Consistently logging these environmental variables prevents misinterpretation. Without this context, you might easily panic and misread a completely normal summer temperature increase as a dangerous fever. If you want to gather supplemental data, you can incorporate a non-contact infrared pet thermometer. However, these specific numbers must only be used to complement your physical, tactile observation, not replace it. Dedicated daily logging transforms random physical observations into a highly reliable, individualized health map that you can actually use. Now that you know how to build your map, let's decode the red flags. The first is localized heat, when one ear base feels significantly warmer than the other. Localized one-sided heat usually points to a specific external issue isolated in that area. This often includes an ear infection, acute irritation from scratching, or severe wax buildup. Contrast that with bilateral heat, where both ears feel unusually hot compared to the forehead. This often indicates a systemic reaction, such as an active immune response or elevated metabolic activity. This brings us to the cardinal rule of thermal mapping. Never evaluate temperature in isolation. You must explicitly cross-reference your ear check with your pet's current appetite, daily energy levels, and social behavior. Observation has limits. If you ever detect a severe temperature shift accompanied by lethargy, vomiting, refusal to eat, or clear signs of pain, stop monitoring immediately and call your veterinarian. Your final task is simple. Commit to repeating this exact 10-second check at the same time every day for the next 2 weeks. Set up your logbook, establish your environmental controls, and begin familiarizing yourself with your pet's baseline. By dedicating just 10 seconds a day to focused physical observation, you step out of a reactive mindset. You become your pet's most effective early warning system, capable of acting the moment their biology tells you they need help. Explicitly cross-reference your ear check with your pet's current appetite, daily energy levels, and social behavior. Observation has limits. If you ever detect a severe temperature shift accompanied by lethargy, vomiting, refusal to eat, or clear signs of pain, stop monitoring immediately and call your veterinarian. Your final task is simple. Commit to repeating this exact 10-second check at the same time every day for the next 2 weeks. Set up your logbook, establish your environmental controls, and begin familiarizing